Hi, I'm Zola, and I'm a craniosacral therapist, which means I work with nerve damage. Woo! God, it's needed. There's a lot of people who have nerve damage. So, how do I treat it? I do something called craniosacral on my table right here. And what I do is I lay you completely flat, and I place my hands underneath your sacrum and your head. And I feel for something called the craniosacral rhythm, which is the circulation of cerebral fluid up and down the spine being pulsed by something called the meninges, which are a shrink wrap covering that covers your entire brain and spinal cord. It's what creates the blood brain barrier. And it moves in a very subtle way, about 8 to 16 times per minute, depending on the person. And it's its own separate rhythm from your heart rate and your breathing, and it's not really affected by your heart rate or your breathing. It only changes as it wants. It doesn't get affected if you do heavy exercise or light exercise. The only time it changes is if you're asleep or you're sedated. And what I'm palpating for is disruptions in the flow, basically, up and down the channel. So I feel where there's moments of kink, where the fluid isn't flowing properly down to the base of the spine, then back up again. And so I encourage it through gentle pulling, very gentle pulling, pulling on that membrane and allowing for there to be openings and fluid flowing the direction it should. And that calms down the nervous system immensely, allowing for you to have more circulation around your nerve, creating something called an afferent nerve connection, which is your brain's awareness and regulation of an area in your body. And when that happens, often a lot of pain goes way down because once your brain's aware of an area, it starts doing self diagnostics and starting to maintain the area better. I've had tons of success doing this, and I've been doing it my whole life. And it's a wonderful way to treat concussions and nerve damage. Why did I do this? Because I've had 14 concussions in my life, and I've totaled a car with my body. I have tons of nerve damage. I've had a lot of accidents, and despite it all, I'm actually in relatively no pain. I'm quite functional, and my body is quite happy. Because once you learn how to do this, you can do it to yourself. I won't say it's an easy technique, but it's not uncommon. You can look it up. It was started by the Upledger Institute in Florida, and it's a fascinating subject. Very gentle work to get deep into the body. If you have any questions, feel free to ask.